Hello, everyone. You're listening to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Dr. Mahmood Kazemi. He is the Senior Director of Global Medical and Scientific Affairs Abbott Diabetes Care. He has professional interest in diabetes technology and innovative therapies. He has successfully transitioned into a career in medical affairs with a focus on defining the appropriate use of novel therapeutic agents and devices in the care of people with diabetes. We're going to talk about diabetes care and management, as well as a device developed by Abbott called the FreeStyle Libre Flash Glucose Monitoring System. With all that said, welcome to the show, Dr. Kazemi. It's a pleasure to have you here.
Thank you, Tabitha. It's a pleasure to be with you today.
Yes, I'm very interested about this topic today. So can you please tell our audience something about yourself and especially your interest when it comes to the field of diabetic care?
Certainly. I have been trained as an endocrinologist, who's a doctor that takes care of people with diabetes as well as other conditions that are in that field. And in terms of what got me interested in this field, I find that with diabetes in particular, although we don't have any cure currently for the particular condition, what we do have are definitely ways of improving the quality of life and allowing people to really live life to their fullest when they have diabetes. And so this is one of the innovations that we've brought forward to help people with diabetes in terms of having glucose monitoring options that are much more convenient, much less painful, and certainly much easier to access than what the options have been in the past for people living with diabetes.
Wow, that's very fascinating information. Now, doctor, tell us about this wonderful product that I've heard about called the FreeStyle Libre Flash Glucose Monitoring System. So how is this different from traditional test strips?
That's a great question, Tabitha. So with FreeStyle Libre, what we've done is provided a convenient and almost painless way of monitoring glucose for people living with diabetes. It consists of having a sensor, which is a rather small item that's placed on the surface of the skin. And there is a very tiny filament that goes into this area beneath the skin that actually measures the glucose levels every 15 minutes. And can actually then communicate that information to a separate reader, which the user uses to scan over the sensor and obtain their readings when they are interested in accessing that information. And the use of this system, there's no requirement for routine finger pricks, which have been really a source of a lot of discomfort, a lot of social embarrassment in many cases for people who need to use these devices to monitor their glucose levels. And as a result, we found that people who are using finger pricks don't tend to monitor as frequently as they should, as based on the guidelines that are published in Australia and other parts of the world. And with the use of a device like FreeStyle Libre, since there is no routine requirement for finger pricks, individuals can simply conveniently and discreetly access their glucose information when they want, and therefore also monitor in a much easier and more convenient fashion. And we've seen that people do, in fact, monitor not only at the recommended guidelines, but at levels far beyond those based on our clinical trial data and real-world data of users with this technology in Europe that we have at this point.
Wow, this sounds like it's a very good device because, as you know, the traditional way for a diabetic to check their blood sugar level is to prick their finger every time in order to check the level of their blood sugar. I remember in my case, my mother was a diabetic herself, and she hated pricking her finger every day just to check her blood sugar levels. And I myself sometimes, even though I'm not a diabetic, but doctors sometimes tell me I'm probably at risk because my mother had it. So I have to check my blood sugar sometimes, and I don't like pricking my finger, doctor.
No, it's completely understandable, Tabitha. I don't think anyone enjoys that process. So you're absolutely right. Currently, the method that many people around the world use to monitor their glucose is through finger pricking, which, as you mentioned, is just a very inconvenient and painful means of obtaining this information. And what we've seen with FreeStyle Libre is that it certainly has been the next big technological innovation that allows people to avoid having to do that routinely and can actually access their glucose information in ways that not only are more convenient, but are more insightful for them, because the device is able to not only obtain the glucose information, but also to display it in patterns that are meaningful for both the user and their healthcare provider. So we found that this really has changed the approach to glucose monitoring in countries where it's been introduced, including Australia. And you're absolutely right that certainly with finger pricks being the way they are, we've seen a lot of progress in the past several decades in terms of diabetes technologies in general. I mean, even before finger pricks were involved, people had to test their urine to find out what their glucose levels were. And then we were able to have blood glucose monitoring come about, which certainly represented a change. But again, it's unfortunately inconvenient, painful, and just not a discrete method of glucose monitoring. And now with FreeStyle Libre, we're able to offer the next big technological innovation that allows people to have access to that information in a convenient and understandable fashion.
Wow, thank you so much, Doctor, for sharing that information. So is it okay? Can you tell us a little bit more about the history and evolution of diabetes management?
Oh, certainly. As I mentioned, this really has changed quite a bit over the past several decades. Back in the 1970s, individuals would routinely use urine monitoring for glucose levels, and certainly the technology back then, that was really where it was at. And then we had the advent of blood glucose monitors, which originally, just like cell phones, were very large when they first came out, were quite large and clunky devices. And certainly through different iterations, they became smaller, more compact, and required less blood for testing. But the bottom line was that they still required blood for testing and still required a finger prick to obtain that blood sample. And therefore, individuals with diabetes did not really monitor as frequently as they could because of the discomfort and the inconvenience associated with this type of testing. And now we have gone to the next step, which is to offer this technology called flash glucose monitoring, of which FreeStyle Libre is a member, that essentially shows individuals their glucose trends and patterns by accessing the information in a much more convenient fashion compared to where we had been even just a few years ago. And in Europe, for example, where it's now been available for close to 3 years, it's certainly revolutionized glucose monitoring in that particular area of the world. And we feel every day with stories from individuals who use this technology as to how it's improved their quality of life, as well as their overall control of their diabetes, because of the fact that they now have access to that monitoring information that previously was just too difficult to obtain for them.
Wow, this is very fascinating. I'm very happy that technology has certainly advanced and that diabetics have now found a way to painlessly check their glucose level instead of just pricking their fingers every day.
Absolutely, as am I. I mean, when I was in clinical practice prior to coming and joining industry, I could tell you that that was one of the areas that I always wanted to encourage my patients to have more information about, was their glucose levels. We often will draw laboratory tests for individuals with diabetes, but without having the actual glucose information, it can be quite difficult to understand which changes we should make as healthcare providers in the treatment regimen based on the laboratory values alone. And therefore, now having access to that information, both for the user in a convenient fashion and for the healthcare provider in a very comprehensive and easy to interpret fashion, has really revolutionized how we manage diabetes overall from both the healthcare provider and the user perspective.
Yes, fantastic. So, Doctor, can you tell us what is currently happening in the wider diabetes space, both internationally and in Australia in particular?
So overall, Tabitha, in terms of the diabetes space, there really has been a move toward individualizing diabetes care. In the past, where we've certainly just used rather broad guidelines that gave general advice, now with the advent of glucose monitoring technologies such as FreeStyle Libre that provide more comprehensive assessments of glucose levels over time for particular individuals, we've been seeing sort of a move away from just general guidelines toward certainly more an individual perspective on diabetes care. And this is something that at Abbott, we certainly are in support of, to ensuring that each individual achieves their best potential and are able to live life to the fullest with diabetes or any other medical condition that they may have. And so this is a very important perspective for us. And we found that this certainly has been gaining traction. And we certainly also have data to support that our users, as I mentioned, are monitoring their glucose levels on a much more frequent basis than they had with blood glucose monitoring, now exceeding the guidelines both in Australia and globally when they use FreeStyle Libre. For example, in our real-world data, we found in Europe that individuals were scanning on average 16 times per day. And this is in clearly a much greater level than people who were using blood glucose testing, at a much greater level than even the typical guidelines would recommend in Europe or in Australia or in the US for that matter. And they actually are using this information to help improve their overall diabetes control. So this individualization and access to information is very important.
Yes, I agree with you because diabetes is a condition where there's no cure, and it's sometimes difficult to manage, especially depending on the person. So, doctor, I'm curious, can you tell us what's the difference between type 1 and type 2 diabetes?
Sure. So type 1 diabetes and as opposed to type 2 diabetes, there are two different conditions. In the case of type 1, individuals are no longer able to produce insulin, which is the hormone that takes glucose or sugar from the bloodstream into cells. In the case, again, of type 1, individuals are no longer able to produce insulin themselves, and they therefore must inject or otherwise obtain insulin through an infusion in order to be able to have that hormone present in their bodies to allow for that movement to occur from glucose from the bloodstream to the cells. In the case of type 2 diabetes, which is the one that I think is more commonly the ones that people oftentimes are cognizant of because they may have family members who are affected by it, et cetera. In the case of type 2, this is when there is still insulin in the person's body, but it's not sufficient for their body's needs. So they either will need to use oral medications or injectable medications to augment their insulin release, or in some cases, over time, they may actually need to supplement with insulin injections or infusions themselves. But the difference, again, is in terms of the onset of the condition. In both cases, the glucose levels rise and there is a need for further therapy. But in the case of type 1, that therapy, because there is no insulin in the body, it has to be insulin from the beginning. Whereas in type 2, there are other options initially, but may progress to requiring insulin.
Okay, thank you, doctor, for explaining the difference between type 1 and type 2 diabetes. Doctor, like I mentioned earlier, my mother herself was a diabetic, and doctors have told me in the past that I might be at risk of getting diabetes. So can you tell me, doctor, is this true? For example, if someone has diabetes, can they pass that on to their children or grandchildren?
So the answer to that question is that we do know that there is a genetic predisposition toward type 2 diabetes in particular that can occur. It doesn't mean that it's inevitable. It means that if you have a family history of diabetes, whether it be type 1 or type 2, to speak to your healthcare provider and have an assessment made as to whether there is a requirement for screening or any other type of testing. But certainly there is known to be a genetic component, particularly in the case of type 2 diabetes. But as I mentioned, it's not an inevitability. And as far as what needs to be done, it really has to be individualized for each person with their healthcare provider, as long as they discuss the family history.
Okay, thank you for your advice, doctor. I really appreciate that because this is something that actually frightens me, especially in the past, because like I mentioned, since my mother had diabetes and every time the doctor always tells me you might get it, so please watch your diet, exercise. So this is something that does frighten me, but now since you mentioned that it really depends on the person, so it's not really like an automatic case where if someone has diabetes, they automatically pass it on to their children.
That's correct. It's not, as I mentioned, an inevitability, but certainly there are some genetic factors at work there. And as I mentioned, the key thing is to have an honest and open discussion with the healthcare provider about the family history and take the advice of the healthcare provider from there.
Yes, thank you, doctor, for your advice. Okay, now let's talk about the future of diabetes trends. So can you tell us what is the future of diabetes trends or management?
Absolutely. So I think in the world of future developments, one of the key things that we're seeing overall is this movement toward a quantified self, which is certainly the wearing of wearables of various forms that track information and trend information for people with respect to their health parameters. And so this would include, for example, different devices that might track the number of steps per day or amount of intake of various things. And along those lines, in the world of diabetes, we are finding that a wearable device like FreeStyle Libre is really very important in terms of tracking glucose trends and being able to visualize those and be able to make informed treatment decisions based on what's being seen. So I would say that the future of diabetes, like many other things, is really, as I mentioned previously, toward this sort of individual approach with the use of wearables to obtain individual information and then use that information for appropriate treatment decisions, both on the part of the patient and the healthcare provider. So this is certainly a move that we're seeing, this quantified self movement that we feel that we also are part of when it comes to tracking of glucose levels in the world of diabetes.
Okay, thank you so much, Doctor, for sharing that information with us. Now let's talk about the FreeStyle Libre. From my understanding, Doctor, the Australian government is looking into reimbursement of this particular product. So how important is this for people living with diabetes?
Well, to answer that question for you, Tabitha, I think that we have heard from many users of the technology here in Australia that it certainly has changed how they manage their diabetes in terms of being able to actually access this glucose information that previously was not convenient or straightforward for them to access. Now, with the use of Libre, they clearly have used adjectives like life-changing, revolutionary, types of descriptors when it comes to the use of this technology. So we're very optimistic that the technology will gain even greater use in Australia, and we're certainly working with the different government authorities to obtain long-term reimbursement for that. But we currently, again, are in discussions regarding that. But we hope to make the technology accessible to all the people who may benefit from it in Australia.
Well, I hope so, because this is a fantastic product, especially this could help make diabetes management much easier for people and much painless.
Absolutely. And that's certainly what we've seen around the world, including Australia. So it really has been a great privilege of mine in my career to be able to be a part of this and see how it's really changed the lives of people living with diabetes, which is really a 24-hour condition. You never get a break from it. And to at least have this one improvement in this aspect of having to deal with it all the time has really changed people's approach to the living with diabetes. And I see it every day when I talk to users around the world and also here in Australia. So it's certainly been a privilege, and I hope to, again, be able to help bring this technology to even more people who I feel would benefit from it.
Okay, that's wonderful. Okay, now, Doctor, since earlier we were talking about the difference between type 1 and type 2 diabetes, now can you tell us what kind of dietary guidelines should diabetics follow?
So with respect to dietary intake, Tabitha, this is an area where there is a lot of discussion among different folks in the diabetes world. So in the past, there have tried to be very strict sort of meal guidelines, et cetera, that have occurred in different types of guideline approaches. But I think more and more, just like I mentioned, diabetes management in general is becoming individualized. I think dietary management to a large extent is becoming individualized as well, where there isn't a clear answer of you may or may not eat something, but more a question of how much of that something would you like to eat and how could it fit into a larger dietary plan that would ensure adequate nutrition and proper control of glucose levels. So to answer your question, there's really no hard and fast rule per se about that. We certainly do give guidelines still to help people make informed food choices, but more and more with dietitians, the rule has become, let me hear what you would like to eat and let's work out a plan that we could possibly incorporate that into a meaningful overall approach to managing your diabetes.
Wow, that's very interesting, Doctor, because in the past I have heard that some doctors give very strict guidelines in what a diabetic can eat and cannot eat, but according to you, it sounds like these things are changing as time goes by.
Absolutely. Just like overall how we approach diabetes management, this has certainly been a move again toward an individual approach. Certainly there are foods that we know will cause glucose levels to rise much more quickly than others. But again, depending on how the individual wants to incorporate those into an overall diabetes management plan, there are different ways in which to look at those types of foods and see if there's any way to incorporate appropriate quantities and times of those. So it's certainly, again, moving away from just rigid guidelines toward more of a flexible individual approach that incorporates the individual's needs and desires and lifestyle into what will become a much more reasonable management plan that people can adhere to. Because we know that one of the absolutely clear things for us is that if we create a management plan that is just unfeasible for someone to follow, they will clearly not follow it in a very quick fashion. And that really does no one good, neither the person who's being prescribed that plan nor the person who's doing the prescribing. So we need to take into account the individual's needs and desires and have that as part of a comprehensive management plan.
Wow, thank you, Doctor, for sharing this information with us, because this is very fascinating how diabetes management has changed over the years, not only in terms of dietary guidelines, but also how they can manage their diabetes and how they can check their glucose level.
Absolutely. And for example, we feel that for like a technology like FreeStyle Libre can really help with that, because if there are some decisions that are being made with respect to dietary intake, like you were asking about, and the individual is now implementing those and wants to get a sense of how they're affecting their diabetes management, they can very easily access their glucose levels to determine the effect of various foods, of various exercise plans, etc., by simply scanning over the sensor and getting meaningful glucose levels back in a very quick and comprehensive fashion. So this is really where a technology like Libre not only allows people to have convenient and easy access to information, but also meaningful information that helps them adjust their regimens according to what they're seeing occur with various dietary intake, exercise regimens, etc.
Okay, thank you so much, Doctor. Now, I want to ask you, is there any misconception regarding diabetes or its treatment and management you'd like to clear up today?
Well, I do think that one of the key things that we often hear is that if someone has to use insulin therapy, that it somehow is an indicator that their diabetes is out of control. And I would like to clarify that misconception, because it is insulin is one treatment option among many. Just simply having to use insulin therapy by itself is not an indicator that people are in some sort of difficult phase of diabetes or an end stage of diabetes in any means whatsoever. So it's important to keep in mind that if someone's being recommended for insulin therapy by their healthcare provider, that they have the appropriate discussion with that healthcare provider and understand what the rationale is for it, and not take that to be an indicator that things are at a very late stage for them in any way whatsoever. It's important that, again, that just simply be considered one treatment option among many, and if the healthcare provider is recommending that they have, again, an open and honest discussion about the benefits and risks and make an informed decision together.
Thank you so much for clearing that misconception, Doctor. Now, can you tell us what is your main takeaway message to all of our listeners out there?
Well, I would say that for that, Tabitha, I would encourage people who are living with diabetes to really be able to access this glucose information for themselves, because it's important that they have the ability to see their trends and to be able to make informed treatment decisions, both for themselves and to allow their healthcare providers to help guide them by the use of devices that allow them to have access to this glucose information in an easy and almost painless fashion. So whether it's the use of FreeStyle Libre or other technologies, the important point here is to be able to have that glucose information, because in the end, diabetes is about managing glucose levels. And if you don't actually know what your glucose levels are, you can't really make informed treatment decisions. So my takeaway for them is to please, if you are living with diabetes, certainly follow your healthcare provider's guidance, and please consider technologies that allow you to obtain your glucose information in a convenient and insightful fashion, and have the discussion with your healthcare provider about what some of those options are.
Wow, that was a fantastic message, Doctor. Thank you. Now, here's your last question. How can people get in touch with you, especially those who want to get a hold of the FreeStyle Libre flash glucose monitoring system?
So with respect to, in Australia, how they can access information around FreeStyle Libre, there is a website that they can refer to, and that information is freestylelibre.com.au. And on the website, there will be information that they can refer to. And again, I would encourage any individual who is considering this type of technology to also have a discussion with their healthcare provider to ensure that, again, they have a ability to discuss any questions they may have. And then if they do decide to begin the technology, the healthcare provider can also help provide that initial guidance of how to use the technology appropriately to make individual treatment decisions. But certainly, again, the website would be the first step to gain additional information, and then they can move forward from there. There's plenty of information on that site.
Thank you so much, Doctor. I really appreciate your time. This was a very fascinating topic today.
It was my pleasure, Tabitha. Thank you for having me on.
And that was Dr. Mahmood Kazemi, Senior Director of Global Medical and Scientific Affairs, Abbott Diabetes Care. We have just been talking about the FreeStyle Libre Flash Glucose Monitoring System, which helps diabetics keep their blood sugar levels in control. We also talked about diabetes management and care. If you like this interview, transcripts and archives are available at www.hpr.fm. We are on all social media platforms, so don't forget to like, follow, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.